Hi everyone, it's Erin from Midland Mencap, and today we're going to be looking at mental health awareness in children. So we just get the presentation up for you. So what do you think we mean by the term mental health? Exactly the same as what we did in the mental health awareness for adults. Mental health in children doesn't necessarily mean that a child is unwell. Mental health is something that every child has, and the same as every child has physical health. However, it can fluctuate day by day depending on their vulnerabilities at this moment in time. So some children may have good mental health, other children may have poor mental health, and that could mean that they are experiencing poor emotional well-being with or without a diagnosis. So the most common mental health conditions in children are stress, anxiety, and depression. So what do you think are the signs and symptoms and causes of stress in a child? You can pause the screen and take some notes if you want to. So when we're looking at stress in children, stress, anxiety and depression do manifest slightly different in children as they do in adults. So with stress in children, we may notice that they start to get quite angry, agitated and frustrated more than usual. This can mean that they start to lash out. So stress, anxiety and depression in children can manifest more physically than it does emotionally. This can then start to impact them physically. So it may be that they experience hair loss, the same as we do as adults. It may be that they start to get very teary and quite upset. And again, they may experience thoughts of suicide or self-harm. Causes for stress in children could be bullying, that could be online cyberbullying, or it could be at school. It could be that they start to pick up on things that us as adults are stressing about. So our stress kind of impacts them, and that might be a cause of their stress. So try and have a think if there's anything in particular that you think could be causing your child or a child that you know stress. If we look at anxiety, signs and symptoms and causes of anxiety. With children, one of the main signs and symptoms that can happen in anxiety is bedwetting. So children may experience bedwetting if they're feeling quite anxious. You may notice that they start to withdraw a lot as well from social situations. Things like attachment or separation anxiety can be caused in children. So if they're used to an adult being there and suddenly we're not, that can cause huge anxiety for them. Meeting new groups of people doesn't affect most children, but can really impact on others, particularly if they're quite quiet and shy in nature. Other signs and symptoms for anxiety in children that you may notice is, again, overthinking. You might notice it in their behaviours. So again, more physical manifestations. So if they're acting things out, or they're starting to become quite agitated, or they're starting to talk really fast and things seem to be a little bit more panicky than normal, again, that could be a sign of anxiety in a child. So the signs, symptoms and causes of depression in a child. Again, with depression, they may experience it similar to we do, where we feel quite low. We don't want to go out with our friends. They don't want to talk to their peers. You may start to notice that, again, they want to withdraw from things. You might notice that they stop engaging in things that they would normally be quite interested in. And again, the causes of this could be bullying. It could be concerns that they have. It may be bereavement if they've lost somebody, particularly 2019, 2020, we have had the coronavirus pandemic. So this could be a huge cause of concern for a lot of children. They've been isolated from their friends, from their families, and that can cause stress, anxiety and depression as well. So another thing that can impact children and young people is social media. So have a think as to how you think social media could impact on a child or a young person. I want you to have a think of the top 5 platforms that you are aware of. Obviously, we've got Facebook, Instagram, Twitter, YouTube, and Snapchat, but there are ones that we don't tend to think of as sort of online social media. Things like online gaming can be included in these platforms, and online gaming has online forums, chat rooms where you can talk to people live. This can be a huge place for bullying to happen and encounter. And it's really important that we are aware of all the things that do happen on the social media platforms. So there are 6 new Facebook profiles created every second. 1.49 billion daily active users logging onto Facebook every day. So that doesn't just mean that it's on our phone, on the app. It means that there are 1.49 billion people that actively use Facebook. So logging on, liking things, scrolling down the news feed. 83% of parents are friends with their children online, which is a good sign because it's quite a lot of people. However, there's still that percentage of parents that aren't aware as to what's being posted on their children's social media, and that can start to be a cause for concern if there isn't parental guidance or supervising it. 350 million photos are uploaded per day on various different social media accounts. So, do any of these link up with things that you came up with? So, social media can impact children's self-esteem. This could happen for so many different reasons, and we've got a few of them here, where we look at the filters and the comparison trap. Filters are a massive thing now on social media, and not a lot of children take photos of how they actually look nowadays, which can be really, really detrimental to their mental health. They are used to seeing themselves looking very different to how they would normally, and that's due to the use of filters. Also, when they fall into the comparison trap, when they look at what other children have, what other children's lives are like, and they may wish that their lives were like that. That might be the life that they want, and that can make them feel really low, really depressed. The usage, so the amount of time that they're using social media for, it starts to disconnect them at times. Now, at the moment, obviously, everything is online, and we are encouraging them to connect with people online. However, in normal circumstances, sometimes it can put them very much into a virtual world, and that isn't always the best, particularly if they're withdrawing from the people that they live with. Also, what's happening in their usage time? Are they experiencing bullying that could impact their mental health? What conversations are they having in their usage time? And then likes and follows. Instagram has stopped showing how many likes people do get on photos, which has helped with this slightly. But there is still that competition on other different platforms as to how many likes people are getting per photo, and also how many followers. So it's a constant competition for children and young people to keep up and to be better than one another. Suicide is something that does happen in children and young people, so we are going to go over it today. However, we are going to look at the facts and figures rather than anything that should cause too much upset. So the first one is suicide is the second biggest killer in children, adolescents and young adults aged 10 to 24. Do you think that is true or false? It is true. So unfortunately, suicide is the second biggest killer in children, adolescents and young adults aged between 10 and 24. The Office of National Statistics shows a 5% increase of young people taking their own life in the last year alone. Do you think that's true or false? It was actually 15% in the last year. So that's a massive amount of children that have died by suicide. From January the 1st, 2020 to the 17th of May, 2020, there were 53 deaths by suicide in under 19s. So this was just before the coronavirus lockdown and at the very beginning. So true or false, 53 deaths by suicide. Again, it was false, and there had already been 72 deaths by suicide in that time of the year in 2020. In the world, one person dies by suicide every 5 minutes. True or false? False. It's every 40 seconds. And lastly, children that die by suicide don't always want to die. They just want their situation to improve or their pain to stop. True or false? That is true. A lot of children that die by suicide don't always want to die, but they do want everything to go away. They just don't know how to make that happen. So looking at signs of suicide ideation, if you notice that a child is talking about wanting to die or wanting to kill themselves, or possibly writing about it, that's a huge indication that those are true feelings. It's very scary because what we tend to do with children is assume that they are attention seeking, but it's really important to express that a lot of children are attention needing rather than attention seeking. And attention needing means that they are expressing these things to us because they want help. They do want the attention, but they also need it because they're in a situation that they don't know how to get out of. Talking about feeling hopeless or sad, children don't always have the vocabulary that we do to explain to somebody that we're feeling depressed. But we need to look out for things like, I'm feeling really sad, I'm feeling hopeless, I feel like there's no point anymore. Those sort of words are things that could indicate that a child is feeling very low and having thoughts of suicide. Again, talking about being trapped or being in pain, acting anxious, agitated or reckless. You may start to notice that there is impact on their sleep or the way that they engage with others. So being, withdrawing or feeling isolated. If they start to have lack of interest at school with their friends or with their teachers, or lack of interest in activities that they would normally enjoy. You may notice that they start to show anger or rage or talking about revenge. Displaying extreme mood swings, so they're up and down, and one minute they're happy, the next minute they're really angry. And then possibly giving their favourite toys away to their siblings or friends because they don't need them any longer. That's a massive sign that they have thought about suicide and that they possibly have a plan to take their own life. Okay. So I want you to have a think as to how we can support children. So pause the screen and write down what you can come up with. Open conversations are really important with children and allowing them that safe space to do so, to talk about what they need to talk about, knowing that they won't get in trouble for it. With children, the main breakdown of conversation is that they fear they're going to get told off for feeling sad or feeling upset or having these sorts of suicide or self-harming. We need to ensure that they know that they won't be in trouble for having these conversations with us. Another thing that we can do is really try to encourage them to make us aware as to what the cause is. If we're aware of the cause as an adult, we may be able to help them. It may be bullying online. It may be things at school that are happening. We need to try to encourage them to engage in activities and engage with their peers and get them involved and really try and support them through that. It may be that actually we need the help from professionals, so taking them to the GP and looking at maybe putting referrals in for CBT, or to CAMS, so mental health organisations for children. So coping strategies at schools. So schools do have like educational psychologists. They also have Senko teams. And we may be able to discuss it with them regarding their mental health. They may be able to put a little bit of a plan in place for children that do experience mental health conditions. It may be that they can have time out when at school if things become quite overwhelming for them. They may be able to get allocated a teaching assistant to support them with their schoolwork, or it may just be making the teachers aware of bullying that is happening that's causing these emotions for them. Again, at home, as we discussed, it's about having those open conversations with them and trying to understand the cause. That can really help us then put coping strategies in place. It may be that we do need that further help from GPs, putting in referrals to CBT, to CAMS, to Healthy Minds, and lots of different mental health organisations. Things in general that we can do with our children is teach them how to give. So maybe doing like little letters to the people that they do love, giving them support, give them your time. It will help them feel good. Try and encourage them to take up a new hobby, something else to focus on, maybe with a different friendship group, people that they can meet, new people that they can get involved in. With things being on Zoom, it makes it easier to get involved in groups that we wouldn't normally be able to access. So trying to encourage them to keep learning also keeps their brain stimulated and hopefully increase things like dopamine and the chemicals in the brain that are good for us. Being active, again, encouraging them to engage in physical activity is really important for mental health. It increases the serotonin and can reduce the feelings of anxiety and depression. So trying to get them to engage in 30 minutes of physical activity every single day. Taking notice, so things like mindfulness, particularly for anxiety, can really help. So mindfulness bubbles, mindfulness relaxation, downloading apps such as Calm or Headspace can help children that do in particular experience anxiety. And then of course we've got the connect. So as we've discussed, really encouraging children to connect with the people that they trust. This could be their peers as well if they feel comfortable talking to their peers, but if not, trying to encourage them to talk to adults that they trust. I hope you found that course useful. If you do have any questions, feel free to get in contact with myself further. Thank you, everyone. Bye.